everyone. I'm so glad you're all here. Tonight's a special night because I have to brag a little bit. I happen to have the best group of doctor friends that you could ever ask for. I've got some with me this evening, and I'm really proud to bring them to you because the only people that you're going to see on a panel of Doctors Nights Out are doctors that I know, love, and trust. Many of these doctors I've even broken bread with. I mean, that's how important this is to me, because the doctors in my circle, and the reason why I love them so much is because they have the same values as I do, which is to keep learning and to keep growing to serve you. What you're going to find is these doctors, they're the consummate truth seekers. That's really what we are. We're truth seekers, and we're out there fighting for you all the time. And so let me go over really quick. They're all medical doctors. We've got Dr. Matt Cook. We've got Dr. Anna Cabeca. We've got Dr. Anthony Youn, Dr. Amy Shaw, and Dr. Vincent Padre. And I have to tell you, I don't usually spend a lot of time reading bios because I know this is when I lose y'all, because y'all don't have a long attention span. But I have to, because this is so unbelievable, the credentials behind these folks. So Dr. Amy Shaw graduated magna cum laude from Cornell University's world-renowned School of Nutrition. It's the best nutrition school in the country. She went on to receive her medical doctorate with distinction, training from Cornell, Harvard, and Columbia. And she's done just about everything. I mean, this woman she's out on the clinic floor. She's done unbelievable things. She's a dear friend of mine. And what she really is owning in a big way, because of her vast knowledge base, is this whole concept of intermittent fasting and how you can apply that to all areas of our life. Dr. Tony Youn, Anthony Youn, who's also a good friend. I met Tony years ago where my corporate office, the headquarters are in Birmingham, Michigan, and he has a very well-known plastic surgeon practice out there. That's what he does. But what he does is very unique because he is not someone who jumps to surgery right away. In fact, he actually has people come into his office and he sends away and says, hey, guess what? You don't need surgery. And that's actually the norm for him. So Dr. Anthony Youn is known as America's holistic plastic surgeon. He's a nationally recognized board-certified plastic surgeon. He's known as a leader in the field. He's authored a bunch of books that I love. Tony is really funny. That's what you're going to find. He has books Playing God, The Age Fix, and Stitches. And we really our visions connected. We both did PBS. I'm sure you've heard about his. If you haven't, it's called The Age Fix. It was excellent. We have Dr. Vincent Padre, who is an unbelievable functional medicine doctor. I'm so proud to know him. I tell everyone about him. You know, he's one of those doctors out there. You tell him, I don't care what's wrong with you. You could have either broken your elbow or you have something that no one knows what it is. He'll figure it out. So he is a constant learner. He is an MD, functional certified practitioner in functional medicine. He is the medical director of Padre Integrative Health and the president of Dr. Padre Wellness. He's a board certified internist in private practice in New York City since 2004. And he's got an unbelievable philosophy, and this is where we really connect. He blends Eastern and Western medicine. He's a professor. He does everything. He's just really smart. That's what you need to know. We love him. And Dr. Anna Cabeca. Dr. Anna Cabeca, so you probably, if you are on my emails, you get my information, then you probably know who Dr. Cabeca is because she is my go-to person for hormones. She and I have been friends for a long time, and that friendship really came out of the strength of complete respect. Her knowledge base is unbelievable, and she takes the time with women that I have not seen practitioners do in a very long time. She listens and she feels and she navigates really beautifully. She is an internationally acclaimed menopause and sexual health expert, global speaker, pioneer, promoter of women's health. She's an Emory University trained and triple board certified in gynecological medicine and anti-aging medicine and regenerative medicine. She has all kinds of books out, #1 best-selling author of The Hormone Fix, on and on and on. She is your girlfriend in medicine. Dr. Matt Cook. Dr. Cook's a newer friend who was introduced to me from the unbelievably generous and kind and amazing JJ Virgin just recently. And I'm really happy that she did. We got on a phone call and we started talking about what's going on with COVID and medicines and medication. So, and because he's a trained anesthesiologist, he really understands how different medicines affect the body. And I was so impressed with him that I had to get to know him a little better. So he's the founder of Bio Reset Medical. He's an regenerative medicine specialist and the president of Bio Reset Medical in Campbell, California. He graduated University of Washington School of Medicine, unbelievable university, and completed his residency in anesthesiology in the University of California, San Francisco. He's a board certified anesthesiologist, over 20 years of experience, on and on and on. Flat out, he's amazing. And I have to tell you, all of these doctors, all of them, I'm so proud to call my friend, and you're going to get great information. And I also have to talk, we got Amy Shaw. Did we talk about Dr. Amy Shaw? Okay, we got her. Okay, Dr. Tony Youn, we talked about him. Dr. Vincent Padre, you're going to hear from him. Dr. Anna Cabeca, we talked about Dr. Matt. So let's get right to it. So we have some great doctors, and we've been hearing a lot about all of the stats, all of the details, all of the warnings out there on this coronavirus or COVID-19. And the goal for all of us here tonight is to really get out of the weeds. We want to get out of the weeds, and we want to hit all of the high level value takeaways to keep you all healthy, to keep you all safe, and most of all, sane. So I want to open up the floor, and here's how we're going to do it here tonight. I'm going to ask each one of the physicians some specific questions that I know are more aligned with their specialty. And then after each one, we're going to open the floor up and we're going to talk a little bit about each topic. And then at the end, we're going to have some rapid fire questions. So I want to start the floor. I want to open it up with Dr. Shaw. Amy Shaw, are you there? Dr. Shaw? Did we lose Dr. Shaw?
Is she there now? For some reason
she's there.
She's there.
Just,
Can you hear me?
Yeah.
Okay, we can now. We didn't want to.
Okay.
We can.
Somebody muted all attendees, and so that was. So I'm here. Hi.
Okay, great. Hi, it's great to see you, Dr. Shaw.
So nice to see you.
So I have been enjoying your Instagram. You should follow her on Instagram. She's really incredible, and we'll get to all the details of that. She's the fasting MD, fasting doc. So Dr. Shaw, you've been talking a lot about COVID-19. So here's the basic questions that I want to know right now. Who is most at risk today? Because every day I keep hearing it's an adolescent disease, it's a pediatric, it's not a pediatric disease. Now I'm hearing that people are unfortunately dying under the age of 50. So who's most at risk, and why is it that some people go through this and they're perfectly healthy, and other people have the disease or the virus and they become critically ill? Why is that?
Great questions. And some of these are, a lot of this we don't know, and a lot of this we're learning as we go on. So just back up a little bit. So it's a SARS-CoV-2 virus causes the disease called COVID-19. Now, what it does is this virus goes on into our cells, and it tries to enter through a receptor called the ACE2 receptor. So there's some speculation that children have less of the ACE2 receptor, that some people have more of the ACE2 receptor, and makes you more susceptible. Now, we do know that older people seem to have terrible outcomes. I mean, that is something we do know from the experience we've seen in China, the experience in Italy. Older people just tend to do worse.
Older by 60 and older?
Now,
60 and older? What is older?
Yeah, 60 and older, but really 75 and older is where it gets really convergent, right? Divergent. Now, the issue is that what we're finding is that in some cohorts, like in the South Korea cohort, where they tested everyone, it looks like the younger people were often the carriers of the disease, and they're spreading it to the older people who are more likely to die or suffer from the disease. So if you're talking about who's more likely to get it, I think we can't really say who's more likely. We can say young can get it, but they'll likely have low symptoms or no symptoms. But the problem is when they spread it to people whose immune systems are compromised, or people who, because of their genetic makeup or their immune systems, cannot fight this virus, that's where the problem comes in. So I would say the only special group that we are really trying to get more data on is why healthcare workers, why physicians and nurses, and why are they getting more severe outcomes? Is it because they're just exposed more to high viral loads? Is it something else about them? They're tested more, or they're
It's
giving...
so interesting to me, Dr. Shaw, because if it's a matter of receptors, I mean, if a lot of this has to do with receptors, then that kind of cancels that out. That's what's so confusing about this, because you take one turn of understanding and then it takes another sharp turn somewhere else.
No,
So
it's so true.
So let me ask you this about testing. Let's talk about testing for a moment. Are these tests available to everyone? When are they going to be? And should everyone just get tested because everyone should know?
Currently, because of our limited capabilities, they are not recommending that everyone get tested. Although that's rapidly changing. In our state, in Arizona, we have now set up some drive-through centers where soon people who feel like they may have the symptoms are urged to go through the drive-through center without a doctor's order and get the test done. Now, I know these are popping up in many, many places, but in New York City, and Dr. Padre, you can correct me if I'm wrong, I have heard that they are urging providers only to test those who are very ill, and they're not, they don't have the capability of testing people who have mild symptoms or no symptoms. Is that correct?
Is it that they don't show up in the testing? Is that the problem?
No, it's that we don't want to overwhelm the system with people who are quite well or have minor symptoms. We just want people to come for testing at this time if they're showing symptoms. Yeah.
Yeah, I can speak to that. I can tell you that just from being in touch with BioReference, which is one of the main private labs that was allowed to start testing here in New York, and I've been in contact with them, they had limited testing kits. So even in the middle of last week, when we knew this wave was coming and I was asking for testing kits before I closed my office, they still could not run the test. And by the time I had to close my office is when they said we could offer you some limited tests. So I think with limited testing, we're being more selective about the people that are going to get tested. But I do want to say something about the test. So the test that's been developed is originally the first one was developed by the CDC, and they found that it had problems. They couldn't run it. And I think that was a big mistake in this country. They should have let private labs as well, like open up to everybody who wants to create a test to create one. But it's a PCR test, and there's a certain level of subjectivity and inaccuracy when you're doing a PCR because it's dependent on replicating RNA, but someone needs to choose what is the cutoff point. You know, what are we going to call a positive and what are we going to call a negative? So I've been looking at the studies they did in China and South Korea, and you know, they've tested, there were some tests where they tested the same person sequentially multiple times. So say one person got 12 tests, and out of those 12 tests, they tested positive 40% of the time and negative 60% of the time. So these tests are not foolproof. Now the question is, you know, would it be better? And I just got word that testing kits are going to be available to doctors' offices to give to patients that are finger sticks that are not PCRs. They're not looking at RNA, DNA. They're looking at IgG and IgM levels. And maybe that's depending on what they're choosing to use as the antigen for that. Maybe this is a more accurate test. I don't know how precisely it can detect this particular coronavirus versus other coronaviruses. But in some instances, you would say that blood is more foolproof because PCR test that's being sampled from the throat and the nose, it depends on, you know, was the sample a good sample? And then, like I said, there's problems with, it's not black and white, you know, like we like to present to the public. There's a cutoff point that someone subjectively decides is the point where we call it positive and the point below which we don't call it positive. So there are problems with these tests, but I think one thing, and sorry to talk for so long because I feel so passionate about this, is that one reason that South Korea got this under control is because they tested people who had minor symptoms. And then they quarantined them and they quarantined anybody who was in touch with them. We're not doing it right here. If we only have enough testing kits to test the sickest people, we're missing the carriers who are spreading it to the most at-risk people.
right?
Okay, so in a perfect world, if we had enough test kits for everyone, should everybody be tested then, given that so many people are carriers and don't know it? So in a perfect world, we all get tested.
I think in a perfect world, you would lower the criteria for testing and have kind of like some minimal criteria like sore throat, dry cough. You know, what I read is that you can't define this by a fever, by the height of the fever, because there are people presenting that don't get a high fever. And how about all those autoimmune patients who might not mount a good febrile response to an illness? So I think it's really silly to define this as saying like, oh, you're only going to test, and this is what I heard here in New York, that they're only testing if you have a fever above 101, where you're going to miss the people who are below that curve.
I think we're learning every day. It's a learn. So I want to talk a little bit about, and I want to get back to you, Dr. Shaw, because I have a very important question to ask that I know a lot of people are wondering. But before we do that, let's talk about day in the life of all of us for a moment. So we have all these restrictions now, and the world, of course, is changing, and you're all very high-level doctors with very large patient bases. So let's just go through really quickly and tell me, how are you practicing now? How are you practicing? We'll start with you, Dr. Padre. How are you seeing patients? What's happening?
I basically moved my practice to all virtual visits. And luckily, because of the type of work I do in functional medicine and consultative, I have a lot of patients that I can easily just do virtually, and I know them well. Even over the weekend, I actually did a bunch of virtual consultations with patients who were emailing or calling in with symptoms and wondering, do I have COVID-19? What should I do? I've also been sending out emails to my patients with my advice and my perspective on this, and trying to keep them informed on preventive strategies and some natural remedies that I think can help. And I've been updating that email. I've already sent the third version of that email as I read studies and update my information and kind of go back and forth on what I think is the best thing to do in this situation. And just trying to stay in touch with patients through email, doing lives like this, and then just moving everything to virtual that can be virtual. I mean, obviously, if I have to do a physical, I can't do that now, and all of those are going to be postponed. But anything else, I'm doing telemedicine.
And Dr. Cabeca, how about you? How are you seeing patients?
So I am all virtual. And consulting and coaching, but my colleague just south of me is doing drive-up evaluations, which is really fascinating. So I've seen
figure it out. Figure it out. Dr. Cook, how about you?
So my practice is interventional to a large extent. I do a lot of injections and IV therapy. So we shut our practice down last week as soon as this happened, and it came here a little earlier than everywhere else. And so then I've been spending 4 or 5 hours talking on the phone to people like you, trying to cultivate and curate what we're going to do for people. And we're doing a lot of media, and then starting kind of in the next day or two, we're converting to all online.
Okay. And so Dr. Shaw, how about you? You're still in it in the clinic, right?
I'm in it. And, Dr. Kellyann, I think it's important to realize, like, there are a lot of people who are confused and who need care. I saw a ton of people who are having asthma flares, allergy flares, immune system, things that are really urgent and need to be seen and treated. I think what we're trying to do is we're trying to say, hey, if you have minor symptoms and things that can wait, we should be doing online virtual visits, and we have converted all of those patients to online and virtual, but we are still giving care to kind of decompress the hospital system so that they're not seeing all these patients, especially like an acute asthma flare or someone who is in pregnancy wondering, what's going on with their body. So I feel fortunate so far, and the part of the country I'm in, we're still able to provide care both virtually and in person, and educating online. And like Dr. Padre said, I'm constantly looking at the literature for updates and to tell, as you said, on my Instagram, but also through my emails, and just to keep people abreast of like, hey, this is what we're thinking. This is what's the next, this is the next step. This is how we're all thinking about this to help people kind of ease their anxiety.
So let me
Dr.
ask
Shaw,
you a question.
I'm curious if, are you wearing masks at clinic? Like what is the staff doing? That's for
Dr. Shaw, are you wearing masks?
Yes. So one of the things I did yesterday was, in our state, we're having, as they are everywhere, having a shortage of personal protective equipment. So what I did is, we are all trying to speak out as physicians and as healthcare workers that if we're going to go and treat patients and help the healthcare system, we need to make sure our providers and our patients are in a safe situation. So we're really endorsing the use of gloves and masks, and in some cases N95 respirator masks as well.
So I have a question that people are asking anywhere in the health community or people that gravitate towards wellness. I want to talk to you a little bit about sickness behavior. So when I talk about sickness behavior, that is how someone behaves when they have a certain illness or a certain virus. And what's really interesting is that often dictates whether or not we should eat or not eat. So the question becomes, for this virus, is it protective to fast? Should we be eating or should we not be eating during this period? And how should we curtail the amount of food we have given the situation?
Do you want me to comment first?
I do, it's for you, yeah.
Okay. Oh yeah. So intermittent fasting is interesting. It is a stressor on our hormonal system. It's a hormetic stressor. So we really urge that if people are not familiar with intermittent fasting, or if they've never done a 16-hour fasting, you don't start during a crisis like this where likely you're quite stressed as it is. So you think of intermittent fasting kind of like a hormetic stressor such as like a heavy high intensity workout or something like that. So what I tell people is time restricted eating is a type of fasting where you just basically stop eating 3 hours before bed and you just give your body a 12 to 14 hour break, something really easy that's not stressful on your body. And so I'm not recommending for people to go on long fasts or extended fasts or something new for them, but to stick to time restricted eating, or what I like to call circadian fasting, where you kind of just stop eating after dinner and eat in the morning.
Great, that's fantastic. And that makes so much sense if you think about the body's ability to regenerate during that time. Dr. Padre, question for you. You know a lot about the mechanism and the behavior of this virus and how to keep it from spreading. So what is happening in the most lay terms that you can think of, so we can really understand this? And we also hear that the virus can attach and it exists in our hair, our clothes, even our handbags. Is that true? And what do we do? What do we do if that's the case?
Yeah, I mean, that's pretty scary. And for anyone who's listening, like the majority of people are going to get mild disease, so even though it's quite scary for the hospitals, the type of surge of patients they're going to get, which is going to overwhelm the system. But we know that the virus can stay suspended in air, in particles for up to 30 minutes. So let's say you have a patient who came into a room and they were coughing, they might have left particles floating in the air that could transmit the virus. And it seems like this virus is 1,000 times more infectious than the previous, the original SARS-CoV virus. And then there's a question of the distance that it can travel in the air. I've heard 2 to 3 meters, and then there was a report that from China that someone may have gotten it at a distance of 4.3 meters, which is about 12 feet, which seems pretty far. Obviously, you're more at risk if you're in an enclosed space. And we know that it can live on inanimate objects for up to 72 hours. And depending on the type of material, it seems like it might have different lifespan. So it loves plastic and metal, something that's made out of paper or, like the paper bags. It's not going to survive on there for as long. And it seems to only survive 4 hours on copper for whatever reason. But yeah, I mean, you can carry it on your hands, and that's why they're advising people to be really careful about touching their eyes, touching their mouth, because you can be exposed through your eyes or through your mucous membranes. And what we know is that the virus will first infect the throat and the sinus passages, and that's where the beginning of the infection happens for the first 4 to 5 days before it starts moving into the lower respiratory tract, and it seems to then move into the periphery of the lungs and then make its way back centrally. And like Dr. Shah mentioned, it's getting absorbed into the cells by a receptor that's found most commonly in the airways in the throat. It's called the ACE2 receptor, and it's also found in the lung tissue. And there's certain things that can be protective of it, like our sinuses produce nitric oxide. It's a gas that is anti-inflammatory, and it actually shuts down one of the pathways that the virus activates that causes what we call the cytokine storm. So, but so when this virus comes in, it attaches itself to the ACE2 receptor. So it's almost like a lock and key. And then that allows it entry into the cell. It takes over your cellular machinery, because these are non-living organisms. They're not alive, like bacteria.
Which is an enigma in and of itself.
Yeah, I mean, it's basically just a package with an RNA, messenger RNA inside. So it comes in, it takes over your cellular machinery, but they think that there's another way that it's able to spread, and it's through another protein inside cells that gobbles up some of those proteins, and it's called furans. And it seems when that happens, it activates an inflammatory pathway in the cell that really starts to kind of like, that's where the inflammation starts to get out of control, and it makes it really infectious, you know. So once one cell is infected and gets full of viral particles, then if that cell dies, it's going to suddenly explode and spread all the viral particles to the cells around it. And of course, as you're breathing in and out, you're going to suck some of those particles deeper into your lung. So that's how it's gonna then spread into your body and into, I mean, they found that there are receptors for it in the liver, in the heart, and we're seeing, you know, the most complicated patients dying from acute cardiac arrest.
So a question for you, Dr. Cook. I've been hearing a lot about the medications and so forth that has been recommended. And Dr. Padre and I even had an offline conversation about this, hydroxychloroquine, and we've been talking about that, and also Zithromax or the Z-Pak. I mean, this is just information that's out there. So Dr. Cook, and let's talk a little bit about medications. What about these medications? Should people be taking them, A, at all? B, should they be taking them prophylactically to try to prevent this? Or should they take one and not the other, or together? Or what's the story, Dr. Cook?
So that's a great question. We don't know the answer to that, but I'll talk to it a little bit. First of all, from kind of a public health perspective, I called in prescriptions of hydroxychloroquine for a bunch of mutual friends, and within 24 hours, basically, now no one can get a prescription for that in North America, as far as I can tell. So the supply has gone out. I don't think that we should be taking it prophylactically. I do think that and if you look at the study that came out of France, it appeared that when people had upper respiratory symptoms or potentially upper respiratory and gastrointestinal symptoms, they started the hydroxychloroquine. And this is an anti-malarial drug that is very safe. It's been used by millions and millions of people. It's been used for forever. So it's a long safety background. The one thing is that it can delay how electricity moves through the heart, and it specifically lengthens something called the QT interval. And interestingly, there are a number of other drugs that can lengthen the QT interval. And so
the QT interval is the length of time between what and what?
Between the Q wave and the T wave, which is the electrical picture of the heart.
So does it have to do with the heartbeat?
It has to do with how electricity flows through the heart. And based on how electricity flows through the heart, every time the electricity starts in the atrium. And so then that creates a wave. And then the electricity goes down to the ventricle, which is the workhorse that pumps all the blood. And the electrical wave is PQRST. And so this lengthens the time between Q and T. And so overall, it's a very safe drug, but one thing that it can do is it can lengthen that interval in some patients who may have cardiac problems, who may be on other medications that lengthen that can have a problem. And then there's some indication that people who are depleted in folate may be more sensitive to some side effects of this drug. Now then, there's another drug that they added into the study called azithromycin. A lot of people know about that because that's the Z-Pak. Azithromycin is an antibiotic that we traditionally think of as being antibacterial. I'm reading that it may have some antiviral effects, but I would think of it as an antibacterial. What I think they were doing is they're starting to layer that in if people started to get a pneumonia. And so this is all off-label, and we're figuring this out, and we're trying to interpret what people are doing all over the world. But my sense is that if people start to get upper respiratory symptoms, that would probably be an appropriate time to start to take the medication. If, as Dr. Padre said, it went down into their lungs and then all of a sudden the virus is erupting and then spreading further into their lungs, they may at that point have a viral pneumonia, but that viral pneumonia has the potential to have a superinfection where it becomes bacterial and viral. And so then the strategy at that point would be to have a combination of an antiviral, which is the hydroxychloroquine, it's also antiparasitic, and the azithromycin.
Can I make a comment there? I just wanted to comment because I think, today I was hearing some talk like, well, maybe hydroxychloroquine isn't as effective, and apparently some pharmacist groups were saying that. And I think we need to understand the mechanism by which it's actually helping stop this virus. And it turns out that chloroquine and the metabolite of hydroxychloroquine are zinc ionophores. So what that means is they create a pathway through the cell membrane for a 2+ ion, which is what zinc is, to get across a membrane that it's not able to cross on its own. And once zinc gets in there, guess what it does? It blocks that enzyme that is replicating the viral RNA from the virus. So it stops viral replication. So I think in patients who are put on hydroxychloroquine, you also have to put them on zinc.
Very good information. Very good information. Dr. Cabeca, we keep hearing about all this stuff. I get anxious even thinking about all this stuff that we have to know. You specialize in hormones and how we're talking about so many different things and the affects. And what about keeping sane during this period just by having your hormones not just take the hit? What is going on around us that is making people feel so hormonally out of whack right now? I've been hearing it constantly. I'm getting texts, I'm getting emails. People are asking me, they feel crazy right now. So what's happening in our body and what can they do about it?
Yeah, no, this is such a significant issue right now, and where I'm just happy to help, because fear, right? Fear, stress, the anxiety of the evening news, morning news, and just even text messages going back and forth.
Hard. Let me just say something for a moment. We have to be abreast of this, especially as doctors. So I'm really in a kind of you're in between the two. You have to be up on this, and at the same time, you've got to keep yourself in a state where you can be of service. So you have to stay calm. But it's something that everyone's dealing with, listening to all that to stay abreast, but at the same time, having it hit your body.
Right. And the effect of the stress, increasing cortisol, depleting our protective hormones like progesterone, our neuroprotective hormone during this time, is increasing that anxiety, the mood swings, the irritability, the difficulty sleeping. All that is this physiologic consequence. And so, there are several things that we definitely have to do when I'm working with my clients. Is first, you're garnering your thoughts, right? Focusing on the positive. What can you control? When you start worrying about the many things that we can be worrying about right now, compartmentalize, like say, okay, those thoughts keep coming up. I'm going to deal with them at 8 to 8:15 tonight. And so compartmentalization is definitely a technique that I've used to really help me. And then remembering that, like, I am the only one who can upset myself. I can choose how to react. And let's focus on what we are blessed with and grateful for to increase oxytocin, increase a more powerful hormone than cortisol. So laughter, good community, playing with our
Let's
pet.
talk about that for a minute. So oxytocin, how can we get that? What is it and how can we get it? Because that's the feel good stuff, right?
That is the feel good stuff. And that is, exactly what I've been studying for the last several years as I've understood the cortisol oxytocin disconnect, like that feeling of burnout, no longer feeling love, no longer feeling connected, furthering into isolation. And that's what we're really at risk of as a nation right now. And so that cortisol oxytocin disconnect, oxytocin is this hormone of love, bonding, and connection. Many women know that in labor and delivery, when we give IV Pitocin, that's exogenous oxytocin, but it's the hormone of pregnancy, hormone of childbirth, and gives us this loving, bonding connection, also of orgasm and intimacy and hugging and kissing and laughter and playing. It's the joyful hormone. And when oxytocin goes up, cortisol goes down. So the sense of humor.
Can you get it from exercise? Can you get an oxytocin blast from exercise?
You can absolutely get oxytocin blast from exercise, and also from enjoying a good meal, from being in good company, certainly from laughing, and I always say the Italians have low heart disease because it's not the wine they drink, it's the good company they keep at the table, Yeah,
even if they're yelling, they still love each other.
They still love each other.
Yes. That's a Latin thing.
It's a Latin thing too. So I think the real take home then hormonally, and I know there's so many things that you could tell everyone, and we all can with nutrition, and we'll get to that in a moment. But if you could just tell someone, try to raise your oxytocin every day, like diligently, keep that front of mind to combat the cortisol. So we've got cortisol on one side, which is stress, the catecholamines, the norepinephrine, all that stuff. So we want that to be low as possible. And the way we can push that junk down is to increase love, is to increase positive movement through our body, is to increase positive thoughts through our body. So what you're saying, we do have control over this in a sense. It is up to us and a lot of it.
Yes, it absolutely is. And if you look at war-torn areas around the world, like who thrives during and after, love, people with community connection, families that stay together, that makes a big difference. And they celebrate the little things, right? Like now we can't celebrate anyway, celebrate virtually. And I had a client the other day who's being quarantined, and she celebrated with virtual birthday party with her 2-year-old grandchild, and just has totally shifted her. She feels 1,000% better.
I think we're all finding golden nuggets. We're all finding some golden nuggets amidst all of this. Dr. Youn, are you with us? Stacy, do we have Dr. Youn on the line? Because I know he was having technical difficulties earlier.
Yes, we do, and he's not muted. He should be there.
Tony?
Wherefore
art thou?
No.
Is he muted?
No, he is not.
Okay, so we'll get to Tony when Tony.
One second, Tony, can you try again? I think your computer actually might be muted because the system is not.
Yeah, you have to look at your computer.
Okay, so what I'd like to do now is everyone wants some kind of practical take home, and we all have so many gifts that we possess in our bag. For me, and I just want to say, and such a great panel, and we can talk about this, what I'm really realizing about this virus is, you talked about, Dr. Padre, and I believe this from the bottom of my heart. I mean, it starts in your throat, right? A lot of the virus lives and loves the throat and then enters into your body. So let me pose a question to all of you. Does it not make sense then? Could we also know that the mucus thickens in this disease or this virus, gets very thick and solidifies and causes a lot of the problems with people who go far along and really don't have a good outcome. would it then make sense, and I'm just opening the floor up to nutrition and what we can offer people nutritionally, would it not then make sense to try to keep our mucus at all times as a protective mechanism to eat natural mucolytic foods or foods that break mucus all of the time, and to use different kind of antimicrobials? I use Biocidin, I love it. And to sip on warm drinks. You know I'm going to say bone broth. You know I'm going to say it. Sip on warm bone broth. We even have packets that you can open, put in hot water, sip on that, make it easy on yourself. You know, all of these things that are at your disposal. Lemon water. I talk about lemon water all the time. Does it not make sense to eat anti-inflammatory, more on the anti-inflammatory, natural mucolytic type of foods during this time? And could you break that up before it goes into your stomach, where maybe the gastric juices, maybe they can dissolve this thing and it actually won't go into a flare-up? Is this at all possible? Tell me what y'all think.
Let me just say that, you know, the other missing part of this conversation, you know, is, you know, we're talking about this virus and how it's attacking the body, but the other really essential part of the conversation, which is what you're talking about now, is the terrain. And it's the terrain upon which that virus creates an infection. And if your terrain is strong because you eat an anti-inflammatory diet full of plant-based foods, then you're going to have a stronger immune system. You're also going to have a better balance between inflammation and anti-inflammation in your body. And the other thing is not just eating foods that help you break up mucus, but also avoiding mucus-producing foods like dairy, especially for anyone who has already an underlying respiratory illness. You don't want to have anything that could trigger more mucus in your body.
So are you telling patients now not to eat dairy?
I've sent that off in my emails.
Same.
And I told all of my patients you should go off dairy, and especially if you have any respiratory issues, if you have underlying asthma. We're in spring now, which is a time of year that makes people get more mucusy. So if you have spring allergies, go off dairy, like zero dairy. Like that little amount you put in your coffee. I always tell people the body works at microscopic levels. So little is a lot for the body. So what you think is a little is still really big under a microscope. And that's where the body is working, at that microscopic level. So you have to think of it that way and just cut it out completely until we're past this whole situation.
So I'll start out with my kind of prescription for all this nutritionally, and then we'll speak to everyone. So here is what I'm professing during this, and this is just based on everything that I've looked at. I took an overview, kind of did an algorithmic picture. So nutritionally, this is what I see. Drink hot liquids, coffee, tea, soups, lemon water, every 20 minutes if you can. This keeps the mouth moist. And the virus can be, and Vincent, you can tell me, and other doctors, can be washed to the stomach, where the stomach acids can neutralize it before it gets to the lungs. That seems mechanistically to make sense. Gargle with salt water or use an antimicrobial spray. I love Biocidin. That's my favorite. It's a...
Me too.
Yep. So I love Biocidin. I have that.
I don't travel without it ever.
Every 20 minutes I spray it. Viruses attack the hair and clothes. We learned that. Soap kills this virus. We know that. So shower as much as possible.
And I want to say soap kills the virus better than alcohol hand sanitizer.
Yes, we know that to be true. Wash your clothes when you get home. Be vigilant about what you touch. Counters, metallic surfaces like door handles. Please, everyone, if you smoke, now is the time to reset, stop smoking. Use soap that foams. The soap that foams tends to work better. Wash your hands as many times as you can and make sure that it's 20 seconds. So you have to wash your hands like a surgeon. Eat mucolytic foods. You go to my website, you can see anti-mucolytic foods. Elevate not only your vitamin C levels, but your zinc levels as well. I love Zicam used intranasally. That's a really good one. Avoid getting the flu, so do everything you can to protect yourself, because that's going to weaken your system. Eat and drink as many warm things as you can. So Dr. Youn, we have you on. I did not see, you're finally on. And he's so funny. You have to know Dr. Youn. So Dr. Youn, give us your 2 cents tonight. We're talking a lot about what's happening, the latest information. Dr. Youn, you do a lot to help take care of people and help them feel their best. So right now, everyone's kind of dragging around. Everyone's kind of working from their home. They're trying to get used to everything. A lot of the women, we ain't looking our best. And that's okay. But so what would you tell people to?
You look great, Kellyann.
Thank you. Thank you.
Kellyann always looks great. I think that, it's hard because it's such a concerning and stressful time. But when you really think about it, if somebody were to tell you, hey, a week ago, you're going to take the next month off, where you're just going to hang out at home with your family, you can go outside, you can go for a hike, you can do a lot of things that are healthy for you. You just can't go to work. Then a lot of us would say, actually, that sounds pretty good. So the thing that I'm recommending really for my patients, my followers, every day at noon, I try to go on social media and just chat with people, is to take some time to take advantage of some of the things that they do encourage you to do. So one thing that we've done in my family is there's a very simple app on your phone that you can download. It's completely free, called All Trails. And this is an app that's totally free that gives you, if you log in, you put your zip code, it will give you all the different trails in your area for you to go walking on. And it will tell you if the trails are heavily trafficked, if they're lightly trafficked. If you can hit one button and it will give you it'll open up Apple Maps. So if you've got an iPhone, it'll show you exactly where the trailhead is. You can put it right in your map. And I think this is a good time for us to get out there, to do some walking, to see nature, and to really appreciate some of the things that maybe we didn't have time to appreciate before. Take time to take care of yourself. Another thing that I'm recommending, I know Amy is a big fan of this, is intermittent fasting. I don't intermittent fast the days that I operate because I find that I'm just not at my best if I do. But I'm intermittent fasting most mornings now because I don't have nearly as much to do. So by doing that, not only can you help feel better, some people who aren't as active, you can lose some weight during this time, and you can even look better if you do all this stuff. And you can combine that with bone broth and with having coffee and tea. And so there's so much you can do to improve your health, and try to look at this, if you can, in a different way than, oh my gosh, it's so scary and what am I going to do? But maybe as a bit of an opportunity.
I'm kind of looking at this as a way to reset and reconnect to the things that are important to you. Really try to take that time and do that, and it puts you in a different state of mind. So guys, we're running out of time. We're almost a full-blown hour. So I want to go around and I want to ask everyone one thing. I want you to give us, and you have to do it very quickly because we really are running low on time. We've already kept everyone almost an hour, and I hope everyone's enjoyed it. And we have so many questions coming in. I kid you not. We have so many questions. So Stacy, do you want to just ask the panel 1 or 2 questions?
Sure. One question that I have gotten is in terms of exercise. What exercise do you all suggest in regards to this time during when people are feeling a bit of angst? I love the idea of trails, but should we be doing more calm exercises like yoga and Pilates is a question we got a lot.
I would say, listen to your body. Is it time for your restorative exercise routines, or how can you challenge yourself depending on where you're at with some high intensity interval training, so that can increase your testosterone, increase your growth hormone, help you get a better night's sleep. But sometimes, again, it's this cortisol factor. So, more of the restorative exercises, going for longer walks may be what you need.
Okay.
So is it okay to work hard and heavy during this time? I think people are trying to figure out, is this a time where I should be, I guess because stress levels are higher, should I work out my normal routine? I think that's the question everyone wants to know.
I think in my opinion, it depends on what someone is adapted to doing, because if someone's already gotten their body used to doing more intense workouts, they can probably continue that. But if you're kind of like an intermittent exerciser and sometimes you do that high intensity workout, those high intensity workouts do create more inflammation in your body. And one goal we have right now is to keep inflammation as low as possible, to keep, like we were saying, cortisol levels as low as possible. So I think indoor exercises, body weight things that you can do that are also great for the hormones, and yoga, which helps balance the parasympathetic, sympathetic nervous system to be in a more relaxed state. I think those are really important right now.
Dr. Shaw, what do you think about the infrared saunas?
So I'm a fan of infrared saunas. I don't think it's a miracle cure. I think I've heard some things on Facebook and saying that, oh, you can use a sauna to either protect yourself from the virus or not get the virus. I'm a huge proponent of saunas in general. But I also, to the last point, I do think that this is the opportunity, if you live in a place where you have a backyard or you have a garden or you have some access to nature, this is the opportunity for you to use that. And most of us in our crazy hectic lives often are not utilizing the power of sunlight and nature and gardening. And this is the part, this is a time you can actually really use that.
Mm. So let's go around now. I want to keep this to about 5 more minutes max because we're at 8 o'clock. So I want everyone to tell me, what is your favorite protective advice? As just kind of a quick fire question, we'll start with Dr. Cook. Dr. Cook, tell me one thing that you want everyone to know to be the most protective they can during this time.
I like doing vitamin C. I think everybody should be doing oral vitamin C. People are having a hard time getting that. I like giving oral zinc, especially zinc lozenges. And then I'll just throw this out. There's some indication that melatonin may be beneficial since we were talking about hormones.
Can we answer the question, please, about these nebulizers? And should they be used, vaporizers, nebulizers, all that as a preventative?
So the issue, there's some concern that if you're doing nebulizers, that the virus could get on particulates, and so it could increase spread. So at a lot of the emergency rooms, people are actually not offering nebulizers. So what I'm telling people is, if you're going to nebulize, try to do it at home and then try to do it outside. So for example, there's colloidal silver, Designs for Health has a colloidal silver.
Great product brand, Designs for Health, very good product brand.
Yeah, but I would, if you're going to nebulize, I'm going to recommend that people nebulize, and you can also do glutathione and NAC. But if you're going to do that, I recommend you do that in a way so that there's no exposure to anyone around you.
Great. Dr. Youn, what would you advise everyone is the most protective thing they can do during this time?
I would say eat colorful fruits and vegetables, because you do want to flood your body with good, healthy antioxidants. That's going to help keep you healthy. And 100% agree with Matt. I think vitamin C, definitely. There are actually some studies and stories coming out of China about people using vitamin C as a protective and even a potential treatment for it. So,
what form should people take?
For the vitamin C, I mean, just taking a tablet. I mean, it's hard to find.
Tablet, powder, is one better than the other?
I don't have any belief either way. I just would recommend. I mean, some of us, if you can't find, let's say, vitamin C itself, then a lot of multivitamins contain it as well. So if you can get it through that way, then it's just another option.
Dr. Padre, what's one quick fire statement you can give us to be the most protective during these times?
Well, I'm not going to repeat what's already been said, which has been really great points. But something else, so a natural zinc ionospore. So I spoke about how hydroxychloroquine helps get zinc into the cell, which is where it has its antiviral effect. Well, guess what? Quercetin also does that.
Yes.
And you can buy that as a supplement, and they've actually tested quercetin, at least in vitro, and shown that it has an antiviral effect against this coronavirus. So I would say quercetin, and the other one I'm going to throw in there, because I do believe food is medicine, just like Anthony was talking about, medicinal mushrooms. Put them in your bone broth. You can basically boil it, then simmer for about 10 minutes, and you cook the mushrooms in there, and now you've augmented its immune stimulating effect and made yourself even more resistant, because medicinal mushrooms help trigger NK cells, natural killer cells, which help eliminate the cells that are infected so the virus doesn't continue to spread.
Excellent. And Dr. Shaw, quick fire, what would you tell someone, they came to you and they wanted to be as protective as possible during these times?
Yeah, so to add something new to, all of the other points that were done or said, vitamin D is a great supplement to have during this time to boost the immune system. In fact, during my immunology fellowship, that was the immune booster vitamin of the year, because there's countless pathways where vitamin D can help with your immune system. And this is a good time to, if you haven't been tested, tested and get supplemented with that.
Great. So you believe that people should get tested before they start dosing on D, or should they just start taking?
I think that most people are tested or have a history of low or medium, but it's a fat soluble vitamin. So you don't want to be taking high doses of vitamin D without knowing what your baseline D is.
Okay. And for me, I would say as many hot liquids as possible. Keep it super simple. I love broths. If you can make broths spicy, that's considered mucolytic, and that thins the mucus. And that's what I think is super important right now. So thank you to all of our panelists. This has been absolutely amazing. And we could just go on and on. There's so many questions that are coming in. I mean, okay, we'll just take one more question before we go. Just one more. Go ahead. Stacy.
I apologize. I was just answering someone in a chat. So another question that I have gotten is in regards to keeping their nasal passages clean. Is something like a neti pot helpful to them, or a nasal spray other than the Biocitidin going to be helpful to them?
I'm opening the floor.
Yeah, so there is a thought that, when you catch these types of viruses, they come in through the nasal passages quite often. And so if, let's say, you're on a plane and you get off, one thing to do would be to get a nasal spray like X-Clear and to spray your nasal passages. Theoretically, the thought is maybe you can dislodge any type of virus that may be working its way in there. I don't know if there's any true science behind it, but it's something I would definitely do.
So all the doctors, thank you so much. I want everyone to tell everyone how to get in touch with you. So starting with Dr. Shaw, Dr. Amy Shaw, tell everyone where they can find you. Please include your Instagram.
Yeah, I post a lot at Fasting MD on Instagram, and it's amymdwellness.com.
Great. Dr. Youn.
So probably the best place to find me is on YouTube. I've got a YouTube channel, Tony Youn MD. I actually have a video on supplements to consider for trying to stay healthy during this time.
Tell me what that was again, please.
Just Tony Youn MD on my YouTube channel. I'm also on Instagram. I'm everywhere, but the YouTube, there's a nice video there if you're interested in supplements and what to help you stay healthy.
Dr. Cook, where can we find you?
I'm at bioreset.com, and then I'm also at bioresetpodcast.com.
Okay, and Dr. Padre.
As you know, my theme is the gut. So you can find me at happygutlife.com. And I'm on all over social media, but on Instagram, Dr. Padre, Dr. Padre, and I'm pretty active there. So that's a good place to find me.
And Dr. Cabeca, do we give you a quick fire? Can I have a quick fire back from you? I'm sorry, I don't have all of your things up here. Dr. Cabeca, give us a quick fire protective, and
Yes.
tell us where we can get a hold of you.
I agree with everything that was said. Definitely intermittent fasting. I'm going to say go keto green, drink your bone broth, and also vitamin D. I have to second all that. And just something to focus on too is sleep, how important sleep is for restoration. And we have to focus on sleep right now. So adding magnesium in the evening, adding melatonin in the evening. And there, again, the good research looking at the possibly protective effects with higher doses of melatonin in the evening as well. So, that's exactly what I would say. And then just join me in my Keto Green community. I'm going live every day through Easter Sunday, committed to that. And I'm on dranna.com. So my website is dranna.com, Keto Green community on Facebook and Instagram. So I look forward to connecting more.
Thank you to all the doctors tonight, and you can see why I call them friends. So I'm wishing everyone so much grace, so much love, and be well. We'll see you on the next one. And next week.
Thank you.
Thank you.
Good stress.
Thank you.
Bye-bye, everyone.
Thank you all. We'll try to answer some of the questions outside of this as well. And I appreciate your time. And we are going to return next Monday night talking about anxiety and stress, which we're all working with. So have a great night.
Thanks.
Have a great night, everyone.
Good night, everyone.
Thanks, everybody.
Mwah.